Okay, my name is Kayla Rubio and I will be performing tracheostomy care on the patient. So I would introduce myself to the patient and identify his name and date of birth. So yes, can you confirm your name and date of birth? Ryan Race, born on January 20th, 1960. Okay, thank you. I will perform hand hygiene and put my gloves on. So on this one, I will be replacing the disposable inner cannula. So there is an order for daily trach care and as needed. So we do have the order to continue this. Before I would start, I will ask the patient if he had any pain prior to the procedure, just as I would in the suctioning procedure. So are you experiencing any pain? Okay, and if he was, I would administer the medication 30 minutes prior. Okay, so I am going to remove the oxygen that he has, any oxygen therapy he has, and I will, with my non-dominant hand, like hold on to the outer cannula and the faceplate, and I will put it there, and then with my dominant hand take out that inner cannula by pressing on the tabs and unlocking. So I will take that out along with the dressing that's here, so I can also change it. Okay, so I still have the cannula and then the gloves, and I will take that out and dispose of it. So then I will perform hand hygiene. Okay, and I'm gonna open my sterile container here. Okay, I'll be sure to have this here. The towel or disposable pad. Okay, so that's there. And I will take out this. These are my sterile tip, cotton tip applicators. I'll get my sterile container and pour my normal saline in here. Okay, so I am going to be cleaning the site of the stoma, of the tracheostomy. And so I have removed that, and while I removed it, I checked for any signs of infection, such as arrhythmia, swelling, any exudate that was there, and it was not, so it was all clear. And so I will get the tip applicator, put it in the normal saline, and I will clean the top, going from the stoma to the outside. I'm sorry, you can't really see what I'm doing. The stoma to the outside, and I would just use this once per stroke. So I would dispose of that in the trash, and then I will get another one and do the same thing for the bottom. Okay, stoma to the outside. Okay. And then I will pat it dry. So I'm going to use this. Pat it dry. And apply gauze, the 4x4. Okay. And he does have a collar. I'm sorry, I couldn't find nothing to really make a collar, but there is a trach collar there. Okay, and I would change that as well. Okay, so now I am going to insert the new cannula. So I would perform hand hygiene, put on my gloves, and I'm going to be working fast, so we can get that oxygen back to the oxygen therapy. So let's just say this is my new cannula, and I will hold this down with my dominant. I will hold the faceplate down, and I will insert the cannula and make sure to lock it in, and then replace back the oxygen therapy connected to the tracheostomy. So that would be for the disposable nasal cannula. If I were doing a non-disposable nasal cannula, it's basically the same. I would use the stem technique, and I would remove the cannula. I have a basin of pure normal saline, and I have like a container of pure normal saline and then a container of sterile normal saline. So I would put the cannula in that and clean it with the sterile brush to get rid of any of those in and out secretions, and then I will pour the pure normal saline over it, and then I will, with my non-dominant, hold on to that faceplate, and with the cannula I would insert it and lock it. And that is that. Okay, thank you very much.